For today's webinar, we have Dr. Chris Delcher from the University of Kentucky presenting MDI considerations for prescription drug monitoring programs. Without further delay, here's Dr. Delcher.
Well, thank you, Tom, for the introduction. For today's seminar, we'll talk about three objectives. One, we'll identify how medical examiners, coroners use PDMP data for a medical legal death investigation. Two is that we'll understand how MECs access PDMPs, how access to PDMPs is tracked in those state databases, and what methods exist for quantifying measures of PDMP use. And then I hope that you'll gain awareness of new opportunities and barriers for research on how medical examiners and coroners use PDMPs. So let's start with the reason that we're all here, really, and it's due to this exponential increase in drug deaths since 1980. And I say exponential because here is a graphic that was published in the journal Science showing, in fact, this exponential curve in all types of drug deaths, not just limited to opioids, but looking at the mortality rate per 100,000 population from 1980 to 2016. And it's very clearly a drug-related epidemic that has seen different phases, including the crack epidemic, now obviously the opioid epidemic, the fentanyl epidemic, and moving now into a new phase of amphetamine and methamphetamine related overdoses. So if we pick up from that important publication in the journal Science, and we go out to the CDC's website, we pick up from 2016, and here's an interesting website that you may want to take note of, where you can pull down predicted numbers of drug overdoses, suicides, or transportation related deaths by week and by state. From 2016 to 2021, you can very clearly see that we've been on an upward trajectory since 2016. And obviously the impacts of COVID have hit hard in terms of drug overdoses, and that is well known at this point. So you can see that spike in the data towards March, April of 2020. So I just wanted to bring that resource to your attention. So how do we even know this? How do we get the data to understand those trends? Well, as many of you will understand, that data comes from our medical legal death investigation system, or the MDI system. And the PDMP has a role in that, but let me just give you a graphical overview. This is a figure that we actually published in a paper that described the modern complexities of quantifying fatal overdoses when they involve opioids and the challenges involved. And we put together this graphic, and we partly made it complicated on purpose because it is. We also wanted to give an overview for the uninitiated into how this works. So you really start with somebody who has died. On the left-hand side, down at the bottom, you can see death. And then when that death is suspected to be drug involved, and medical examiner or coroner gets notified, and the medical examiner then decides to take on that case, they go through a series of steps that we've graphically laid out here. So they either their office or their case investigators will take death scene statements and interviews. They'll inventory drugs at the scene. They'll do autopsies, toxicology, try and understand the social, behavioral history. And they also check prescription drug monitoring programs. So at the time that we put this graphic together, we really wanted to drive home the importance of prescription drug monitoring programs in this process. Now, everything on the right-hand side of this graphic is really more about how the data ultimately end up in the different types of state and federal systems that then allow us to look back at the trends that I just showed you. But I want to highlight the importance of the PDMP in this process. Now, what is a PDMP? So many of you may not even necessarily understand what a prescription drug monitoring program is, although everyone on the call today lives in a state that has one of these databases. So here's a graphic from the CDC that attempts to explain what one of these electronic prescription drug monitoring programs looks like from the perspective of the people that are using it. So you've got healthcare providers, and these you can think of as prescribers of controlled substances. So they're prescribing to their patients. Their patients then fill those prescriptions at a pharmacy. From that point, those prescriptions, if they're controlled substances, and these are substances such as opioids, benzodiazepines, certain stimulants, sometimes it ranges and differs by state. For example, in Kentucky, gabapentin is a type of nerve pain that's also a controlled substance. So when those prescriptions are dispensed by the pharmacy, they automatically go into the state database that then tracks and monitors those controlled substances. Now, other players in that, what I'll call the PDMP ecosystem, include state health departments, law enforcement, and that's going to be largely the focus of what we're talking about today, healthcare licensure boards, state insurance programs. So there's a lot of players that are involved in looking at this data, but the easiest way to think about it is anytime that you've gone to a physician and maybe you've needed you've had an acute injury and you need a 3-day supply of hydrocodone, which is a controlled substance, you get that prescription, it gets filled, the information then goes off to the state. And these are very, very large databases, as you can imagine, and can sometimes include up to about 30% of any state population. So the chances are good that you've had one of your prescriptions may actually be in this database. So here's what type of information is in a PDMP. So imagine you're a prescriber or you're a dispenser. This is the kind of restricted information. And I do want to make that point clear. Not everybody can just log in to one of these prescription drug monitoring programs. In fact, medical examiners and coroners have had historical problems themselves gaining access, but this is highly restricted and regulated by the state and various either health departments or law enforcement agencies. But once you've registered and you're prescribing or dispensing, then you can log in to the system and you can see the types of prescriptions that your patient is receiving. So here's an example of a patient who has a history back to 2014, who has filled alprazolam, which is a benzodiazepine. And you can see that this fictional data shows that the patient got 60 pills at 30 days with one refill allowed from the Miller pharmacy with the prescriber's name. There's no morphine milligram equivalent because this is not an opioid, and you can see that prescription is no longer active. So you can imagine that through time, you can get a relatively complete picture of a person's prescribing patterns and prescribing histories. And that's really the point of the PDMP, is that you get this information independent of the payer type. So you would see if this patient was paying in cash, if they were paid for by Medicaid, if they were paid for by private insurance. The PDMP would show you that controlled substance prescribing history. Now, who's using these PDMPs? I've already said and shown you a graphic of the prescribers, the dispensers, law enforcement, and others of the like. The use of PDMPs and the different types of people who are using them is also an area of research and of interest. So here are a couple of infographics from the American Medical Association. They really want to drive home the point. They have an entire page on their website dedicated to PDMPs. And their goal is to drive home the point that physicians are registering for the PDMP and using the PDMP. So they've presented some data here. For 2017, they calculated about 1.5 million physicians across the country were using a PDMP. In 2019, that increased to 1.9 million, and that was a very large percent increase relative to 2014. So more and more physicians, as they learn about PDMPs and often are required to use them, are in fact using the PDMPs. And then there's another measure. So you can look at the individual types of users in the PDMP and count and understand that, but you can also monitor the number of times they initiate a query. And again, a query is going back to that page that I showed you, that patient report. You can think of any time you enter a patient's name into the PDMP, that's a query. So you can see here that the state PDMPs, in terms of the number of queries, there were about 460 million queries in 2018, and that's really more than the population of the entire country in terms of queries. And that's only growing through time as more and more physicians and other prescribers use the PDMPs. So another piece of information that I found on the American Medical Association's website is some information on the number of opioid overdose deaths, which is shown in the light blue graphic relative to the opioid prescriptions, and that's shown in the purple underneath. And basically the bottom line is opioid prescribing itself is coming down. One of the reasons for that is the use of the PDMP. Yet our overdoses continue to increase, and many of you will understand that to mean that the illicit drug supply really is now largely contaminated with fentanyl, if you can say it that way. So reductions in prescribing have helped for sure, but there's still access to a great deal of illicit drugs on the street. You can see there are a couple of additional data points here with a quantification of 2.7 billion queries to the PDMP since 2014. I said that there are multiple types users of the PDMPs, and most of the research really has been focused on how prescribers and dispensers use PDMPs because really they are the heaviest users. But some of our work has bled into understanding how law enforcement uses the PDMPs and the impacts that law enforcement might have. So here are results from a survey that we published in 2017 that asked a couple of questions. This particular question was to understand how frequently law enforcement used the PDMP, and this didn't include medical examiners at the time. And you can see that about 17.5% of the law enforcement users that we surveyed indicated that they were very frequent users of the PDMP. And we wanted to know, well, what about any kind of communication with prescribers and dispensers as a result of using the PDMP? And you can imagine law enforcement, their interest in using and completing a case is to really prosecute in instances of doctor shopping. And this is when a patient may go to multiple prescribers and receive multiple types of controlled substances with the presumed intent of diversion, which is selling those drugs on the street potentially. Law enforcement may also have a role in understanding and finding high prescribers with unusual prescribing patterns. So that's why they're in the PDMP. But we wanted to understand, well, how frequently did that lead to increases in communication with the healthcare? And what you see here is that for the most part, law enforcement responded that they, among the three groups shown here, prescribers, pharmacists, and law enforcement, that they increased their communication more with the pharmacists than the prescribers, and even more than other law enforcement groups, which is interesting. Another set of questions was related to the effectiveness of the PDMPs. So one question on the left-hand side is, did the PDMP have a positive impact on reducing prescription drug abuse? You can see about a third strongly agreed with that. and whether or not the PDMP had specifically altered patterns of prescribing for Schedule II opioid pain relievers in a manner that was beneficial to public health. Again, 40% of law enforcement users agreed that the PDMP had served that function. So that led us to think a little bit more in detail about medical examiners. And again, when you work in this type of epidemiology, you understand the role of the medical examiners, and you understand how important it is for them to have as much information as they can to make a determination as to the cause of death. So we wanted to really understand in which states could medical examiners, coroners access the PDMP for the purposes of completing a death investigation. And we started back in 2012 to kind of look at, from the policy perspective, which states provided access and which did not. So the states shown in blue, starting back in 2012, you can see that the states in blue are far fewer than the states in orange. And the states in orange are those without access to the PDMP. But as you go through time up to the last data point that we looked at was 2018, you can see by 2018, most of the country provided and allowed the medical examiner's coroner to access the PDMP in some manner or another. Since then, just a quick update, I found out that Massachusetts and Connecticut have also since allowed since 2018. So that leaves us probably with only a handful of states that don't allow it. So now that we know that medical examiners and coroners can access PDMPs in most states, then it becomes a question of, okay, well, how can we monitor and see how frequently they are in fact using those PDMPs and for what reasons? So here's an example from Florida with actual data, and these are the kinds of, again, tracking at the database level, the kind of information that you can get. So as of June 10, 2019, when we put this together, there were 7 medical examiners that had created accounts with the PDMP. And I think that there are 20 some odd medical examiners in Florida. So that gave the PDMP a sense of how they might target their educational outreach to get more medical examiners involved. A request here is like a query. I've already explained whenever you put in this case, it's a decedent. So they would make a request for information. You can see that 62 requests were made in 2018, 47 in 2019. And then there's a particular type of setup that makes it easier for the medical examiner who's over an office of people. They can actually create delegate accounts. And that allows them to offload the day-to-day logistics of logging into the PDMP and doing those searches and pulling back that information and getting it out of the system and putting it into their case investigations. So that can be really, really helpful. That also happens on the healthcare side. And you can see that when that's been growing. So 182 of those delegates made requests in 2018 and 310 in 2019. So the ability to do that increased the opportunity to increase the queries in the PDMP. Okay, so here's another way of thinking about it. Again, my role is kind of as a researcher. I'm not only interested, and I'm about to tell you a little bit about how the medical examiners actually use the PDMP, which is one of the objectives of today's, but I'm also, again, interested in kind of comparing their use to other types of PDMP users. So here's kind of a neat graphic that shows you, one, the different types of players in the PDMP ecosystem. And this is data that comes from Florida that's publicly available. You can see by far the largest number of people who are using the PDMP are physicians at 43,009 down towards the bottom of your screen. So that in parentheses is the total number of that particular type of healthcare professional. But then the bubbles are scaled to how many queries per population of that type of provider, what's their intensity of queries. And so you can see the pharmacists then are querying at the highest rate, even though there are almost half as many of those in Florida that are using the PDMP. If you look towards the center of the graphic, you can see the medical examiners. There are 45, and that's probably, again, includes their delegate. But you can see their intensity of use is far less than most other groups, which, again, makes sense because they're only using the PDMP in the course of a death investigation as opposed to routine healthcare. So let's get back to one of the main objectives for today, which is how do medical examiners actually use the PDMP to their advantage? Well, I've talked to a few, and I'm not an expert, but having had a few conversations over the years, here's a few things that I've learned. Medical examiners see the PDMP as an extension, really, of the medical record. And what that does is it helps them make a connection between the decedent and a treating physician or a pharmacist near or around the time of death, which you can think of that as a contact tracing function. So as they're piecing together what happened to this person, they're going to want to talk to their healthcare providers. Well, the PDMP has all of that information available from the last prescription. So they use that in the course of the investigation. They can also use the lack of that information in terms of making a decision as to whether or not they will take jurisdiction over that death. So if they don't find a prescribing physician, if the patient has no history and there's no other means of finding out that information, they may then take over the legal obligation of signing that death certificate. They also have a role in seeing certain patterns play out among their decedents. And if they notice particular prescribers that are affiliated or associated more frequently with overdoses, they may have a role in communicating that with other types of law enforcement like the DEA. I don't know how common that is. Again, that's a matter of research. This is just sort of based on a few conversations that I've had. They can also use the PDMP, again, as a tool to help identify a person when, again, there's no other means, so they can look a bit further back in the PDMP to continue to find healthcare providers that might know something about the person that they're investigating. They can use the PDMP in the course of their participation in fatality review teams for a number of different types of domains, such as child fatalities, although there wouldn't necessarily be many children in the PDMP, although that also varies by state, pregnancy-related fatalities, that sort of thing. And then there's also the information that they would use in terms of the actual medications that they're seeing that those decedents have taken through history. So they can use that information to kind of target the types of toxicology that they might want to test for. If, for example, the resources are limited and they have to select a handful of panels to use, they may look at the drug history and determine what they would want to target. They can look at the types of drugs and the frequencies and the overlaps in the prescriptions to get a history or a probable misuse or abuse determination. They can look at what's been prescribed and look at what's been collected in terms of pill bottles at the scene of death and make some determination as to what happened to those drugs. So, for example, they may find that the decedent recently filled for a full 30-day supply, and then when they got to the scene, all of those pills were missing from the bottle. So that can give them a sense of whether or not that medication was being diverted, or maybe a family member or friend took the extras after death. They can make some guesses as to the opioid tolerance levels in the decedent or prior to death based on the dosage and the types of opioids and other medications. And then again, they can judge the level of substances that are found in the blood as to whether or not they were therapeutic or lethal levels. Again, there's judgment involved there, so that is triangulated with other information. A recent discussion led to adding this bullet point where a medical examiner was looking at a decline in dosages, and in combination with some information from a suicide letter, helped explain that this decedent was being tapered off of the opioid probably faster than they should have been. And so that helped the ME understand that to be a suicide. And whenever law enforcement contacts a medical examiner about a legal investigation into the decedent, again, the medical examiner can give law enforcement some sense of the baseline as to whether or not the types and dosages were unusual for that patient. So those are kind of the day-to-day routine operations of how a medical examiner coroner uses PDMP. And I just wanted to start to wrap up today's seminar with a discussion about how we can think about research opportunities for how medical examiners use PDMPs. And one opportunity, I think, is to understand workflow. And as far as I know, there hasn't been a lot of research into how the PDMP plays into being helpful for the ME's workflow, beyond the ME's reporting that it's very helpful, but quantifying that. And here's a couple of examples from the Government Accounting Office that looked into how PDMPs were helpful in terms of finding and investigating doctor shoppers. And this might be analogous to the type of workflow research that we would want to conduct. So in Kentucky, for example, it used to take about 156 days to complete an investigation of a quote unquote doctor shopper. And then after the PDMP, that average investigation time dropped 16 days. So that's an incredible time savings. I don't know what that would be for a medical examiner, but that's the type of research question that we might want to be thinking about. Same in Nevada, investigation times for quote unquote doctor shoppers reduced from about 120 days to 20 days, and an 80% reduction in investigation in Utah. Other types of questions that we could ask are related to the ME's investigation itself and how that plays into our understanding of the epidemic. So here's an example of where an ME told me that they would use the PDMP to understand whether or not the patient was in chronic pain before death. And so even if the medical record did not indicate that the patient had chronic pain, the ME could determine from the types of medications and other elements of the investigation that a history of depression was likely, and would then put that into their notes. And so that might be an opportunity to understand how we can get more information on and better information in terms of depression, for example, even if it's not something that's been officially diagnosed in the medical record. And that leads me to give a plug for some new work that we're engaged in that involves a process called natural language processing. And how does that information allow us to compare what's in the case investigation notes and the PDMP? And so I'll just explain very, very briefly what natural language processing is. And it's almost exactly what it sounds like. The medical examiners write a lot of notes, and their case investigators in their offices write a lot of notes. And that information often doesn't make it into our surveillance system. So we have recently received some funding from the CDC to apply what's called natural language processing, where we basically train computers to read these notes and pull out information that we can then analyze in a quantitative way. Here's a very simple example using a sentence that might be written by a medical examiner or a case investigation. Our project is called Stimulink. The sentence was, I was informed the decedent chewed tobacco, moderately drank alcohol, and abused prescription pills and cocaine. And what natural language processing would do is to go through and automatically identify different components of this sentence. So for example, the chewing tobacco part of this sentence gets categorized into the individual behavior concept. The moderately drank alcohol gets categorized as a qualitative concept because of the moderately part. And then the drank and the alcohol each get broken down into basically a verb and an organic chemical. So you can see that people build dictionaries and methods for being able to comb through a large number of these notes. And we've done this, and this is actually a reference down here to a paper where we've done this with medical examiner notes and have had some success with pulling out information on, for example, family members who are at the scene at the time of death. Also, a location of the death in terms of commercial, residential, natural areas, that sort of thing. So that's going to be our next big research opportunity with medical examiners is pulling in those case notes, and we'll be able to then compare that to the other information that they're pulling together from the PDMP, and hopefully be able to unlock a large amount of that information that's currently just sitting there waiting to be used and to provide some new insight on the drug overdose epidemic that is exponential, and that sort of loops us back to the very first slide from today. Here are some additional resources. I was able to participate in a meeting that was organized a couple of years ago around prescription drug monitoring programs and medical examiner use. So that is a publicly available document that you can pull down. And then there is also some really helpful information on recommendations for how medical examiners and case investigators might investigate opioid-related deaths, which is critical right now. So with that, I'll leave you with my email address and my Twitter handle, and thank you very much.
All right. Thank you, Dr. Delcher, for such a fantastic and informative presentation. Let's go ahead and get right into some questions from the audience. First question I have here is, can PDMPs design their systems to help improve case investigations?
Thanks, Tom. Great question. I think they can, and I think that should be an area of future research. So one thing that we know from the healthcare provider side is that very often the information that they get out of a PDMP is essentially a line list of prescriptions that have been dispensed on a certain day and by a certain pharmacy and prescribed by a certain prescriber. But you can imagine if that list is quite long, which it can be in some instances, that could really benefit from some data design. And there has been some research around how just the more simplified presentation of that type of information could really help reduce the time it takes to digest that information. And so I think that there's opportunities like that in the medical examiner world. We just need to sort of sit down with more medical examiners and I think talk through the types of analyses and mental processes that they go through when they're trying to understand a PDMP history report.
Another question I have here, can you describe a little more about how you would compare written notes to what is in the PDMP and why that's helpful?
Yeah, so anybody who's worked with the country's overdose surveillance data knows that it typically includes the basic demographics, maybe the county that a person died in, the types of drugs involved, at a very high level, and some other sort of information that's relatively easy to standardize and get off of a death certificate. there are initiatives underway to try and improve and enhance the types of information that would typically get sent to a federal agency like the CDC. One area of really active research is how to take advantage of all of the really rich notes that are written by a case investigator. And the challenge with that, of course, is that these are essentially not handwritten, but thoughts that a case investigator might have at the scene of death and as they're wrapping up an investigation. So it's a research challenge to try and read that information using computers and to make some sense of it. But we know that from previous research that in those notes, you really get a lot of information in terms of a social determinants of health and other types of medical conditions, even that go well beyond our standard surveillance. So one idea, for example, is that you may have a medical examiner who notes that there was a prescription for oxycodone found at the scene of death, yet there was no PDMP record of that prescription. So that would tell us something about the circumstances around that death, but we'd have to use that natural language processing and then compare that to ultimately the information that the ME pulled out of the PDMP together. We're far off from that, but we're moving in that direction.
Actually got another question here about the language processing and Simulink. And first thing they asked was if you had any new updates or any projections on where that system's going, its availability, all that kind of fun stuff. And then they also asked if you knew if they were utilizing it for any similar applications adjacent to, you specifically talked about the PDMP, but if there was any similar applications considering more or less everything associated with PDMPs and this type of work has some sort of handwritten or at least personal language process to it. So I was curious, they're curious if you know of any applications of Simulink in those things adjacent to just this application that you referenced.
Okay, a couple of questions there. So Stimulink is our brand new project, literally just was awarded at the end of September. So we don't have any updates yet other than we're getting it off the ground. However, it is based on some prior work that we've done. And what we did was we took some medical examiner case notes from a carfentanil, which is a fentanyl analog outbreak in Florida, and we applied methods from the electronic medical record world. And so what we wanted to do was to take this NLP that's being used now more frequently for electronic medical record reading of physician notes. And we wanted to just apply it straight up to the medical examiner notes to see if we could get away with pulling out any information without really going through the pains of modifying the dictionaries and all that. And part of that was that we argued, well, medical examiners, they tend to use this very formal medical language because of their training. And so we thought that, well, that they're trained physicians, so they probably talk very similarly. And therefore we could apply those methods to the medical examiner notes. And that ended up being very, very helpful. And we've since extended that work to a certain degree here. We haven't published it yet, but it's related to determining when naloxone is administered in the course of an EMS run. And very often the naloxone is administered and it's talked about in the notes, but for whatever reason, it doesn't make its way into the structured data. So we're underestimating the amount of naloxone that EMS is delivering without being able to read these notes. Let's see, I think that answers the two questions that you asked.
Yeah, no, absolutely. I mean, that was great. Thank you. I know that was kind of a multi-stepped question, but absolutely to that point. I mean, between the physician notes, EMS notes, everything, it seems to be a pretty constant struggle that all these different reporting systems on all these different aspects that surround MDI, they don't really talk to each other all that often. So thank you for giving that background, because I think that'll really hopefully open up the ability to pull that information out from somewhere else, since it can't be connected one for one like you would expect. Shifting gears a little bit back to just the PDMP in general, I've got a question here. Do other states allow MECs to see records in other states? So they're mentioning that medical examiners and coroner offices on the border of our state are interested in being able to see PDMP records in a neighboring state, but it's not always allowed.
I think that that is the answer, really. It's not always allowed, and I'm not sure, to be honest with you. I know that more and more PDMPs are regionalizing themselves in a way that allows the prescribers and the pharmacists to look across state borders. I don't know the status of allowing the MEs to do that. It sounds like in this case, the person who's asking the question may know of instances where that's possible, but that's a good question. We need what we call policy surveillance. We need people to go through and catalog instances in states where that type of thing is possible, because then we can see if that makes a difference and how frequently that need is there.
Absolutely. And kind of in that same vein, just from a different perspective based off of the patient treatment. So this is more of a comment, but I'd like to get your insight, or at least just anything that you might want to add to this. Somebody in the chat said medication assisted treatment clinics do not report to PDMPs. And so this is a challenge for possible methadone related deaths, or knowing that a decedent was receiving treatment for substance use disorder. Do you have any kind of comments or anything that you want to add to that, other than the obvious that person stated that that's definitely a challenge?
Well, that's where the combination of both of those sources of information would help alleviate that problem, because the medical examiner may gain knowledge of that patient having had a history of treatment. And if that makes its way into the note for that person, then as a researcher, for example, or anyone, like a case fatality review team, they would then be able to fill that hole that the PDMP is not giving them any methadone prescriptions, but the medical examiner knows that, and that makes its way into the file, and then ultimately we understand the circumstances a bit more.
Going a little bit deeper in there, can you give a couple more specific examples of what other jurisdictions pull from the PDMP and how the medical examiner and coroner uses it? Good question.
I don't have, that's part of what I've been trying to do recently, is to think about a more systematic way of gathering that type of information. And you can imagine it's been a while since we've all been able to travel and get to conferences where I can get in front of an audience of medical examiners and try and pull out some more of these cases. In terms of the PDMPs and the types of information that is being made available, it can vary. So for example, here in Kentucky, we have a very interesting situation where you can actually request information on a prior drug conviction for your patient if you are a prescriber. I think that may be a very rare situation where that type of very, very specialized information is available in the PDMP. And we actually have done some research around whether or not prescribers would even use that feature, and most of them say no. Whether or not that is also available to a coroner in this case, because Kentucky is a coroner state, I'm not sure. I'd have to double check and see if they have access to that same information. But again, we have the same questions. What would they do with that? Is it helpful? Does it provide any additional insight?
Absolutely. Yeah, I know the the same problem that plagues us all is trying to make those connections with people that we normally would have done in conferences and meetings and whatnot. It's kind of like hard that age old question of you don't know what you don't know, and that used to be the conduit to do it. But hoping maybe you've been able to talk to some people in these circles. We actually had a webinar over the summer, which was a panel on overdose fatality reviews and a couple of different approaches to it based off of we had representatives from some state level health departments, some local health departments, county level, all kind of range in the municipality. And I'm curious if you foresee, or maybe it's already being applied, the use of the PDMP in those overdose fatality reviews and those social autopsies as they call them.
I think the PDMP information is being used in those instances. And I guess I just want to reiterate that it still is a very restricted and guarded process of gaining access to a PDMP. So I don't think that you necessarily are given access to look up decedents in a PDMP just because you're part of a fatality review team. Maybe that happens in some cases, I'm not sure. But that information is probably brought to the table by either a prescriber or a dispenser or a medical examiner as a part of the case file. So I do think it's important. I don't want to give the impression at all that you can just put in a web address and get to a PDMP and start logging in and checking things out. It can be cumbersome. In fact, that was sort of the point of the maps earlier in the seminar. You would think that it would be kind of a non-controversial issue to get medical examiners access to PDMPs, especially when we're talking about people who have already died. But it hasn't been. It's been a difficult process, and part of it is sort of an interesting role that the medical examiners have in terms of straddling healthcare and law enforcement, and some other privacy issues. So the fact that now most medical examiners live in states that do allow it is kind of a victory for them. And again, we want to understand the real barriers to doing that. There can be a difference between a policy that allows them access versus the realities of what it actually takes to gain access for their investigations.
Yeah, absolutely. And that was actually going to be kind of my follow-up comment was, and this was covered to a degree in that previous webinar, but it is a little tricky because you're dealing with this kind of overlap between social work and counseling work, as well as then the actual medical examination and the MDI component where you're trying to, it seems like a lot of these groups, these fatality reviews are trying to thread that needle so that you can bring the information in that is otherwise bring the information in a way that it is still protected as it should be, but bringing it in a way ideally that it is still useful to the overall review in some sort of redacted form. So definitely I wanted to follow up with that comment, and also just I'm glad you brought that up, because it is kind of it's a needle definitely to thread, I think, for a lot of overdose review, fatality review groups. So I got another comment here actually, but I think also would be helpful to get your take on it. So somebody in the chat said, my offices use the PDMP to identify treating physicians to get complete medical records, but the hazard is to jump to a conclusion of substance use disorder without a complete medication list. So I don't know if maybe in your initial study or review, have you seen anything where it's more possible for that to occur, or anything like that that might be helpful to think about as people use and review the PDMPs?
Yeah, I mentioned that in the seminar recording that there is still a great deal of judgment that is involved in both the art and science of an investigation. So that's exactly what our Stimulating project is trying to do. Is we've got a very unique system here in Kentucky where we automatically link death certificates, toxicology, PDMP records, and all of that is happening consistently now for the purposes of surveillance. And what we want to do is then plug all of that into an electronic medical record and link patients to be able to see exactly what this question is getting at, is how complete a record can we get once we have the ability to link these data sources together, and how can we do that in a way that is automated and then helps us understand where these holes in the investigation occur, and ultimately what that tells us about the epidemic. So that's a great question. I hope to get an answer to that in the next year or so.
Absolutely. I have another question here. Can you give examples of kind of some of the PDMP data that is incorporated into the death file or fatality report, or at least give some additional examples maybe that we didn't cover so far?
Well, that piece of it is not really my expertise. I'm not sure. I've never been on one of those teams, so I don't know exactly what gets brought to the table. I can tell you that here in Kentucky, for example, when we link a decedent to their PDMP, basically we ask questions, that you can imagine, questions like, did they fill an opioid prescription in the past 3, 6, 9 months? Did they fill a benzodiazepine prescription in the last 3, 6, 9 months? So that type of information is, once we've linked them to their PDMP records, then we create a series of those measures for the purposes of reporting to understand whether or not there is more of a prescription type pathway to that death, or likewise, if there is no record in the PDMP, presuming that everything else is accurate, then we would assume more of an illicit pathway. So that's how we're currently using linked PDMP data in the course of our overdose fatality surveillance system. But unfortunately, I don't know exactly what goes into one of those fatality reviews.
Sure. No, and I appreciate you framing it in the way that you did, because that is the tricky part. Is I know that it's only one aspect of this whole entire picture. Just going to put out one final call for any questions out in the audience. We got about 5 minutes left in the hour. And while we're waiting for any final questions, Dr. Delcher, did you have anything else that you wanted to add or reiterate before we start closing things up?
I guess the only thing that I'll say is that, I have a soft spot for medical examiners and coroners because I don't think that people often appreciate the work that they do in terms of, in my world, the epidemiologic surveillance and how much we rely on their efforts. So I'm always in favor of trying to do the types of research that will make their jobs easier and also highlight how important they are to people like me. So I hope that I've been able to do that to a certain degree, and I hope that I'll be able to continue to do that. And I'd love to have anybody in the audience, if they want to reach out to me, if they are a medical examiner or a case investigator and want to connect with me on any of this upcoming research, would love to hear from you.
Awesome. Well, I think that is it. I don't see any more questions coming in, but in that vein, let's go ahead and get your contact information back up on the screen. And also just go ahead and start closing things out and saying thank you, Dr. Delcher, for providing this background knowledge and your time and your expertise to give this presentation and answer some questions. It's really been an awesome experience and a wonderful resource.
Well, thank you guys for the invitation. Enjoyed it.
Awesome. Thank you so much. Before you leave today's webinar, we ask if you could participate in a short 5-minute survey. You will see a checkbox icon directly above the chat. Simply click that button to be linked to the audience feedback survey for today's event. Your feedback about our webinars is critical information that helps us improve and continue to provide you the best webinar experience possible. If you could please take those few moments to complete the survey, we would greatly appreciate it. Lastly, across the top of the live stream window are links to all our social media profiles, including Twitter, LinkedIn, and Facebook, a link to our website at forensiccoe.org, and a link to listen to episodes of the FTCOE's podcast, Just Science. There's also a link to sign up for the FTCOE newsletter so you can stay up to date with everything that FTCOE is doing in support of the forensic community. Thank you again for attending, and we hope everyone has a great day.